Hello, everyone. Welcome to our webinar today. I'm Kerry Cork, a senior staff attorney at the Public Health Law Center, and I'll be talking today about Areca nut. It's often described as betel nut, and tobacco, which is definitely a health disparity problem that can cause severe harm around the world and in the U.S., particularly in U.S. territories and among South and Southeast Asian migrant groups in the U.S. mainland. Betel nut is the fourth most commonly consumed psychoactive substance worldwide after alcohol, nicotine, and caffeine. Despite wide use of this product in certain South and Southeast Asian migrant groups in the U.S. and growing public health concerns related to the practice of chewing betel quid and other products containing areca nut and tobacco, few state or local policies regulate the sale or use of such products. Before I continue, I need to point out that I'm here from the Public Health Law Center, a national nonprofit network of legal centers and attorneys that support public health and tobacco control policy at the state, local, tribal, territorial, and national levels. We do this by providing free legal technical assistance to public health advocates and professionals around the United States in several ways through legal research, policy development, implementation, and defense, a wealth of publications that are on our website, and trainings and presentations such as this one. We don't represent clients in court, and we don't lobby. Finally, our organization is committed to the principle that good public health cannot be achieved without addressing health equity. Okay, so areca nut has been chewed for thousands of years. Approximately 600 million people use areca nut globally, most of whom live in the Asian Pacific region. This region also happens to have the highest rates of oral cancer in the world. And that's because, as we'll discuss in a few minutes, betel nut, when used alone, has major health risks, such as oral and esophageal cancer. And when areca nut is combined with tobacco, a user's risk of premature illness and death is greatly increased. Areca nut is the seed of the fruit of the oriental areca palm, which is found throughout Southeast Asia and the Pacific Islands, and it's a basic ingredient of many widely used chewed products. Betel nut products vary widely and are sold as pre-made products or custom-made for immediate consumption. Products containing areca nut are known by a variety of names depending on where they're found and how they're used. Areca nut and betel nut come from different plants, but areca nut is often referred to as betel nut. And then there's betel quid. This is a product where thin slices of the nut, either natural or processed, are mixed with a variety of substances, including slaked lime, calcium hydroxide, and spices such as cardamom, coconut, and saffron. Most significantly, these ingredients are sometimes mixed with tobacco products or wrapped in the leaf of the Piper betel plant. To use betel quid, a person tucks a pinch of the mixture, the quid, between the cheek and gum, where it remains for an extended period of time, sometimes overnight. As with many types of smokeless tobacco, such as chew or dip tobacco, the user sucks and chews the product and spits out the excess saliva produced. Some addicted users simply swallow the saliva. Betel nut has stimulant and addictive properties of its own, even without tobacco. It's used in a variety of forms throughout the Indian subcontinent, such as Bangladesh, India, Pakistan, as well as Asia and the Pacific region. For example, Cambodia, China, Indonesia, Malaysia, Philippines, Taiwan, Thailand, and Myanmar. It enjoys high social acceptance in many societies, is popular among both men and women, and is common among migrant populations in Australia, Europe, South Africa, Eastern Africa, and North America. A high number of users are those with low economic status or education. After chewing betel nut, the user's lips, mouth, gum, teeth are typically stained red, and the product causes profuse red saliva as well, which looks startlingly similar to blood. The flood of saliva produced by betel results in copious red stains on sidewalks, sides of buildings, hallways, garbage pails, and other areas where betel nut users live or work. In regulating betel nut, authorities need to recognize the deep ingrained cultural practices and beliefs associated with use of this product. For example, it's often used to freshen one's breath after meals or to suppress appetite. Betel is often given to youth because the use of a traditional medicine is not seen as problematic. As I mentioned earlier, the use of betel nut has major health risks, both alone and particularly when combined with tobacco. Betel nut is linked to oral and esophageal cancer, lesions, type 2 diabetes, cardiovascular disease, reproductive issues, tooth loss, and permanent loss of jaw movement. And when betel nut is combined with tobacco, the risk of premature illness and death greatly increases. Here you can see in India how 30% risk, 30% of oral cancers are attributable to betel and tobacco, and that spikes to 50% of all oral cancers when smoking is included in the mix. In most of the US, betel nut must be imported primarily from India and Pakistan. These products are often found in Asian food markets and specialty shops that serve migrant communities. But incidentally, you don't need to go to an out-of-the-way specialty shop to purchase betel nut. Just go online and Google it, and you'll find betel nut available and for sale on eBay, Craigslist, Etsy, and Amazon.com. Unfortunately, few federal, state, or local policies regulate the sale of betel nut or its use, particularly by use. So how does the federal government regulate betel nut? Well, both the U.S. Department of Agriculture, the USDA, and the U.S. Food and Drug Administration, the FDA, regulate areca nut imports. And incidentally, both agencies frequently refer to areca nut as betel nut. Areca nut alone and betel quid, with and without tobacco, are all classified as Group 1 carcinogens by the International Agency for Cancer Research. Still, the USDA treats areca nuts in the same way as walnuts, pistachios, and pecans. Raw shelled areca nuts and processed areca nuts, cooked, dried, ground, are subject to USDA inspection and can be imported into the U.S. from all countries via all ports without a permit from the USDA. The FDA regulates areca nut products as imported foods or when mixed with tobacco as tobacco products. The FDA inspects imported food products for food safety and product labeling and issues import alerts when products are refused admission for sale to the U.S. Import alerts are not legally binding, but are made public to provide guidance to food producers and inspectors. Imported and domestic tobacco products containing areca nut are subject to the FDA's smokeless tobacco regulations because they are chewed or sucked in the mouth as opposed to smoked. These products must display a warning label and cannot be sold to anyone under 21 years of age, and self-service displays and free product samples are only permitted in adult-only facilities. Tobacco products with areca nut also frequently contain spices and flavors, but unlike cigarettes, the FDA does not regulate the use of flavors in smokeless tobacco products. The USDA defines areca or betel nut as, quote, a hard nutmeg-sized seed of the betel palm used as a folk remedy, gnawed to clean teeth or shaved and wrapped in betel leaves to be chewed as a stimulant or breath freshener. The lack of federal regulation of areca nut means that, as with other public health policies, state, local, and territorial governments are in a position to lead. New areca nut policies can be modeled on successful tobacco policies, keeping in mind that there are differences between the affected users and the industry to be regulated. To craft effective public health measures, research needs to be done about products used locally, where these products are purchased, and common cultural and spiritual practices. Here are several regulatory strategies common to commercial tobacco control that some U.S. jurisdictions have used to regulate betel nut. They're all pretty familiar to those of us in commercial tobacco control. Just to note that when we say product definitions, this could mean including in tobacco product definitions examples of artificial or natural substances added during processing as taste enhancers or for other purposes. For example, Oregon, Massachusetts, New York, and Hawaii all include betel or areca nut in their tobacco product definitions. Policies with more precise product definitions can support effective policy enforcement and may be needed to apply minimum price laws and tobacco tax rates for specific products or to limit sales to particular products. Few existing U.S. state or local policies are in place to regulate the sale of the betel nut or its use, particularly by use. Here you can see a few examples, and examples from international experience could also inform U.S. policy development. The U.S. territory, the Commonwealth of the Northern Mariana Islands, is one example of a jurisdiction that has taken significant measures to regulate betel nut. As you can see here, approximately 1 out of 5 adults in the Northern Mariana Islands self-report chewing betel nut in the past 30 days. Most of the betel nut chewers add tobacco to their chew. And here you can see the popularity of current betel nut use among adults by age and ethnicity. Finally, you can see here that cigarettes are the most popular type of tobacco used in betel nut chew among adults in the Northern Mariana Islands. And also, a significant number of current betel nut chewers want to quit. The Northern Mariana Islands have taken a comprehensive approach to licensing and regulating betel nut, including minimum sales age restrictions, compliance checks, display restrictions, and signage. Also, their tobacco cessation program accepts clients who are addicted to betel nut. But it's important to point out that betel nut use is much more common in the Northern Mariana Islands compared to the general population in the rest of the United States. And that a lot of education is still needed in the territory about the health risks of this traditional and familiar product. The problem of betel nut use in the U.S., however, is not restricted to U.S. territories or even immigrant enclaves on the mainland. In 2017, local news in Ohio reported that educators in Columbus had discovered a surge in teenage use of betel nut at schools. The kids had apparently learned of this new addictive substance that was readily accessible through Asian grocery stores, and usage spiked to the level that it became a concern for police and legislators. Several options were considered: total sales prohibitions and raids of businesses, a comprehensive youth school policy to prevent initiation, or the punishment of school children caught with betel. So which one do you think passed into law? It was the third one, punishment of school children. The legislature added betel nut to the prohibited items for students to possess at school, treating it the same as tobacco products. Here's the Ohio law. California also has prohibited betel use and possession at public schools, with the penalty being suspension. U.S. betel use is more commonly found among Southeast Asian refugee communities, including in my home state of Minnesota, where we have a large population of Hmong and Karen immigrants. And here you can see the betel nut stains on the snow. There's a recent concern now with smokeless tobacco, betel nut spitting, and the possible spread of COVID. This ad is taken from Taiwan. There are information gaps in how betel nut policies and culturally sensitive evidence-based cessation interventions can be effectively introduced into communities. There's always a risk of creating an Ohio-like situation where teens who had never used or even heard of a product discover it and its availability and its similarity to tobacco. The basic elements of betel nut policies are very similar to tobacco control policies, as you can see. The importance of flagging findings with clear statements of purpose, clear definitions, concise language, clear scope of regulation, robust enforcement, and well-planned implementation. And as with all health policies, equity needs to be front and center. This is a popular product used for thousands of years by some cultures, so any regulatory approach needs to focus on the industry rather than the individual, with the goal of regulating access and providing education, and still instead of punishing or stigmatizing users. Here are a few of our publications on this topic. We also have resources on regulating flavored commercial tobacco products and many other materials on crafting policies within disparately impacted communities and the importance of working closely within these communities to get buy-in and to identify leaders who can help educate members and support, promote, and champion these policies. Unless people understand the individual health risks of a substance or practice, there may be limited will to address the issue as a health risk to a community. Here's our contact information. Please let us know if you have any questions or comments or would like further information about this topic. Thank you very much. Goodbye.